So what is thumb base arthritis, and who is affected, and why does it happen? Well, this is arthritis at the base of the thumb. So it's this joint here, underneath the long bone in the thumb, but it's commonly the pain can be felt on the front surface of the hand, running here across the muscles that we call the thenar muscles. So it's a wear and tear phenomenon. That joint experiences huge forces during your pinch activities, and so with time the joint can wear. And if that happens, then that may lead to a characteristic pattern of changing of the shape of the thumb. So we call that shouldering of the first metacarpal across here. And it may be painless or it may be painful. And if it's painless, it doesn't necessarily need treatment. But if it's painful, then there's a lot we can offer, which we'll start to talk about in the clinic in terms of helping people with that pain. Who does it affect? Well, it seems to be a sexist condition, so it affects women more than it affects men, and there seems to be a protective effect of estrogen. So after the menopause, ladies are much more likely to experience painful thumb base arthritis. And again, if they do, then there's a lot we can offer through the clinic in order to help them. So what are the main symptoms that people experience? Well, you may notice that there's a change in the shape of the thumb, so that you can develop a step as the bone starts to slightly subtly shift position. But really the cardinal symptom of thumb base arthritis is pain. And it's pain that can be hugely unsettling for people, often pain that makes them dependent on painkillers, and pain that can keep you up at night and essentially start to drive you mad. And when that happens, there really is a lot that we can offer through the clinic at New Victoria in order to help people. So how is thumb base arthritis diagnosed? Well, often the diagnosis can be made clinically just based on the appearance of the thumb, based on that shouldering appearance of the metacarpal that are described, and in the presence of pain. There is, when we examine your thumb, a grind test that we do where we're trying to elicit if the pain is truly from the carpometacarpal joint, as it can sometimes be coming from the joint below, and it's important to distinguish that. But really the gold standard investigation would be an X-ray, and X-rays will show us how far the arthritis has progressed, and that then dictates what treatment we're able to offer you when you come to see us. So for pain related to thumb base arthritis, there's a lot that we would offer before we started to discuss surgery. In the early stages, there are splints that can be bought, in fact, from Amazon in many cases, and common ones are the push prosthesis or the dura prosthesis. And those can really help to redirect the thumb into a more sympathetic position for the joint, so that although the underlying arthritis isn't changed, the position of the joint becomes less painful. And so that can help people manage everyday life without the need for any further treatment in many cases. As the arthritis progresses, we talk to them about hand therapy exercises, and our hand therapists will be able to offer a number of different treatments, including wax-based therapy, which can be really helpful. If it progresses further than that, then we start to talk about steroid injections, which can be done in the clinic or using ultrasound to guide the needle if the arthritis has progressed quite a lot. And the steroid, although again doesn't change the underlying arthritis, is definitely helpful for pain. And if it's helpful for you, it may last several months or even several years before we need to start talking about things such as surgery. So those are really the mainstays of non-operative management. They're splinting, hand therapy, and steroid injections. So when is surgery recommended for base of thumb arthritis? Well, we described non-operative treatment. So surgery, we'd start to discuss if you've tried all of the non-operative treatment and it's failed. And that might be that you've had a number of steroid injections and the initial ones were very helpful, and now more recently they've become less helpful. And if you would describe yourself as being in pain and misery, being made miserable by the symptoms of thumb base arthritis, then we'd start to talk to you about the surgical operations. And there are 3 of these, and we would tailor them according to your lifestyle and according to your needs. The commonest is probably still trapeziectomy, which is an operation to cut out and remove the trapezium bone, the small bone at the base of the thumb. That's a very good operation for pain relief. And we would usually take a slip of a tendon to reconstruct the ligament and help to fill that gap. That's not appropriate for everybody, and there is a newer treatment, which is joint replacement now. So that's almost like a mini upside down hip replacement, and that's associated with a very rapid recovery. So people are back to work and back to function much more quickly after that operation. But there are certain prerequisites that mean that we can't offer it to everybody. But if you were a candidate for that operation, that would get you back to full function in a really rapid manner. And so the results from that have been really encouraging. Lastly, for people who need a very durable option, perhaps manual laborers, we do on occasion discuss a fusion operation where we talk about removing the cartilage from that joint and then using a plate and screws, or sometimes just configurations of screws, to hold the joint solid so that new bone forms across it. And if the joint then doesn't move, it can't cause pain, but that obviously leads to a degree of stiffness. So those are the different options. But when we meet in the clinic, I'll spend a lot of time getting to know you and to understand your hobbies, your interests, and what you want to get out of life. And that allows us together to choose an option that's right for you.